Okay. Yeah. Anyway, few more have to join. So let me just share the PPT. So this is where last slide. This is where we had stopped. So we spoke of ailments from. Okay, and majority of you told you're clear with whatever has been discussed. The next 10-15 minutes, we'll try to understand the characteristic symptoms of colchicum. Okay, so 1 second, mute, mute all. Okay, chalo. Yeah, we'll get back. See now, the third important component of third and probably the last component for today's class. See now again a small diversion, and if you just look at the image, you see all blue balloons or blue smileys, or sad faces, and only one that is in yellow, which is a smiley. So what I'm trying to tell you here is we'll try to take up out of so many blue symptoms in colchicum, we are trying to pick up those yellow things, and yellow here stands for those symptoms in colchicum which are peculiar, which are rare, which are uncommon. Now this is what we call it as the characteristic symptoms. Yes, Nisha also adds which are unique. Okay, which are uncommon, unique, peculiar, characteristic, rare. Those symptoms are what we call it as PQRS. Okay. Now, out of the entire list of symptoms we have in colchicum, we will try to identify those few which are PQRS. Now, as I promised a little while ago, I'll just share a small case, and then we'll go ahead. This was probably in 2007. I don't know how old you were, where exactly you were, but I was into homeopathy. I was practicing homeopathy. 2007, one of our government college student, he had referred his friend. And now the case goes like this. The young couple is a case of secondary infertility. She has conceived almost 3 to 4 times, but unfortunately, she would abort during second month, fourth month, third month. Some month she would abort, and they identified the cause was hypothyroidism. Her thyroid levels were fluctuating. Probably because of that, she was going into miscarriage, is what her gynecologist had told. And the peculiar problem for which my GHMC student referred this case to me was he did not want he did not wanted me to treat her for her infertility. He was very clear and he told me, sir, this lady is not able to take those thyroid tablets. She has got bad morning sickness. Okay. And if she does not take the thyroid tablets, even this month, I mean, this pregnancy, she will abort. So please do something so that the morning sickness is taken care and she can continue taking those thyroid supplements. So that was what the final year student told me, and then they had approached me. So when this young couple came, the lady was in a very bad state. She used to have bad nausea and bad vomiting. When she was narrating, I was asking her, when exactly the nausea is more? When do you feel like nauseating, or when exactly you vomit? Is what I was trying to ask. And husband also was accompanying her. He also told, sir, whenever we talk of food, whenever she has to eat food, this is the time she gets nausea. And the lady who was sitting next to the husband immediately told, sir, even now, when the husband is talking about food, and if I think of food, I can't resist myself from the nausea thought. Okay. Now, this is the symptom the lady gave, and thinking about food also would bring a bad nausea. Fine. Remember, friends, tomorrow, when you get such situations in your clinic, you have to have a few remedies in your mind. Colchicum I very rarely use in my clinic, and this is one case way back in 2007. I still remember the situation very clearly. I had given her colchicum. Now, what made me give her colchicum was this symptom. If you again see the images here, the smell, the sight, the thought. Remember the words, they got lot of weightage, they got lot of meaning. The smell, the thought, the sight. See, the description given in our old Materia Medicas, Allen, Kent, whichever good Materia Medicas you read, this is how they give. Smell, sight, thought of cooked food. Smell, sight, thought of cooked food, specially cooked food will bring a bad nausea. I was reading Clark. I was reading Colchicum in Clark, and Clark beautifully gives in his lecture on colchicum. He says, if you have a colchicum patient at home, the room, the door should be tightly locked. They should be tightly locked to prevent the smell of the food entering their room. I hope you understand. See, as a second year student, you have another remedy in your Materia Medica syllabus. You have a remedy HEPAR. And HEPAR, if you read in Kent says the room, the door should be tightly closed. HEPAR, room and door should be tightly closed for a different reason. I don't know if HEPAR is over for you. A slightest draft of air, if it enters his room, he starts getting sneezing, he starts getting cold. HEPAR is sensitive to cold air. So they want the room, the door to be closed. See, in Colchicum, the room and door has to be closed because the sensitiveness is not for cold air. The sensitiveness is mainly for odor. So mummy is cooking something in the kitchen, and this child can't bear the smell, and they close. And this is something very very serious, because food is something we all need. I don't know how much of miasms are over for you. Food is sora. It's the basic thing we need. And that basic thing we are not able to tolerate is something very, very syphilitic. I'll not go more into the words sora and syphilitic, but purposely I've used this word so that you go back and read Organon, where sora and syphilis is mentioned. So sensitiveness to the odor to the extent it causes fainting from the smell. See, not some bad smells. And your mother is not that bad cook that the smell is something very bad. All mothers are beautiful cooks, and the odor, the aroma is something very nice for us. But colchicum is sensitive to those cooked smell of those cooked food, and they start nauseating to the extent they may even faint. This is very, very, very characteristic. I hope you understand the weightage of the symptom that you have in colchicum. I gave you a live case, I gave an example where I've used, and it has beautifully, beautifully worked. So remember this, very very important. So we'll move ahead and we'll go to the second characteristic thing. Now this was what you already saw. Where did you see this image, and what was where did we use this image? Yes, very good. So this image was used under sphere of action, where I told you acting on the abdomen, acting on the GI, it will cause bad distension. Good, bloating of abdomen and distension. So now distension in colchicum is again very very characteristic. Abdomen is immensely distended with gas, so much it is full of gas. The digestion in colchicum is slowed down. There is indigestion and there is so much of gas accumulation in the abdomen. And what is the subjective feeling? What is the subjective symptom the patient has? He feels that the abdomen would burst. डॉक्टर साहब इतना गैस जमा हुआ है आई फील my abdomen would burst. This is very very characteristic. We'll look at the third characteristic symptom. You saw this again under sphere of action. What will colchicum do acting on the heart? Yes, very good. Pericarditis, inflammation. If not the entire heart, you see the pericardium getting affected. Good. So inflammation. So what you have in colchicum, it will have edema, edema of the pericardium, pericardial effusion, edema of the pleura, the covering of the lung, edema of the serous sacs, the joints, or edema of the abdominal cavity. Okay. Ascites, fluid accumulation in the joint or fluid accumulation in the pleural cavity. So edema, dropsy, very characteristic. I told you about joints, the affinity of colchicum for joint complaints. We highlighted that this remedy has been abused for gout, a very good remedy for gout. Okay. Pains, I will highlight this particular point. Pains which keep going from one joint to another joint, wandering pains, pains which keep shifting from one joint to another joint, very bad pains, pains which they cannot bear. I'll again take a small diversion here. I'll share a case and you will appreciate homeopathy better when we teach materia medica with cases. Though this case I did not give colchicum, but I want you to understand. We had a lady, a very old lady recently, 70 plus. She had come to clinic. Ayo, mama, mama, pain. She is not able to tolerate pain. She is not able to bear pain. Now, this what I try to explain in patient's language. Ayo, doctor, pain, mama, ayo, ayo. Now, this is what we call it as moaning. Please remember, ayo, mama. So this is moaning, moaning, MOANING. Your second year student is too early for you, but the early the better. Get into the homeopathic mode at a very early age, and you will prosper or you will settle early. So moaning. So she had bad pains. That night in my clinic, I gave her arsenic malt. And next day morning, I get a call from her granddaughter telling, sir, she is not able to tolerate pain. She is weeping with pain and she wants to take allopathy. She says she can't bear pains. Please do something. Or should I take her to allopathy? Okay. So again, I retook the case over phone, and this girl went to the clinic. She took one medicine, and this medicine is also there in your syllabus, second year syllabus. And many times we will not think of this remedy. Now this remedy is chamomilla. Now, out of curiosity, after this class, please go back and read chamomilla. Now, chamomilla has got something, they're very, very sensitive to pain. They weep with pain, they shout with pain, and the word a chamomilla patient often uses is I can't bear. And in your materia medica, it is given the same way. The nickname of chamomilla is they can't bear. They can't bear pain, very sensitive. Now, why I'm giving you this example here is chamomilla, generally we think of chamomilla in kids. It's a child remedy. But chamomilla for pains I had given to a lady who is 70 plus. Now, after a dose of chamomilla, I asked the granddaughter to again call me so that we can decide if she has to go to allopathy or if she'll be fine with homeopathy. After 2 hours, the grandchild calls and says, Doctor, the pains are much, much better. My granny is very much relaxed. She is doing good. Now, the previous remedy, arsenic amalgam, did not help. This is what I wanted to highlight. Why arsenic amalgam did not help? I only gave arsenic amalgam. Next day, I only gave chamomilla. Why arsenic did not help and why chamomilla helped? Now, this is the clarity you as young homeopath should have. Arsenic did not work because that case, the similimum was not covered by arsenic. And next day morning, chamomilla worked. Again, it is homeopathic remedy. Chamomilla worked because chamomilla covered the similarity. Similia similibus curanter. So that matching, arsenic was wrong, it was my fault, and chamomilla was right, and naturally you saw the results. The entire people at home, they were so much convinced because the granny was so cranky, she wanted to go to an allopath, but after 2 hours, pains come down, she is calm, she says, no, 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 we'll continue with the same medicine, I'm doing much, much better. Now that is the transformation, what a right homeopathic medicine can make. Now this is what you need to have. Don't get confused, that was chamomilla and this is colchicum. Colchicum will have more of shifting pains. Now what do you understand by shifting pains? The lady says, sir, sometimes the pain is in shoulder, then I have pain in the knees, then the pain will be in the elbows, then the pain in the wrist. They keep changing. Now this changing is what we call it as wandering pains. Okay. So 3, 4 characteristic symptoms we spoke here. What was the first characteristic symptom that we discussed here? First one, very, very important was, what was the first characteristic symptom? Yes, very good. The first characteristic symptom was nausea. And why nausea became characteristic in colchicum? Because nausea at sight. I'm repeating this many times so that it gets deeply rooted in your mind and you don't miss it. Sight, smell, thought. Somebody has beautifully written. Yes, that's how I want it. Sight, smell, thought. Especially of cooked food. Very good. Cooked food. Second thing we spoke of what? Again, a symptom related to the J. Yes, we spoke of distension. And third thing we are talking of, we spoke of swelling, edema. And fourth, we spoke of joint affections. Fifth, what we have is again a GA symptom. Now, this is more of a dysentery. The character of dysentery in colchicum, very, very interesting. Stools which are jelly-like, stools which has scraping of intestines, mucousy stools, mucus like scraping of intestines, jelly-like mucus, and there is a severe pain and an urge to pass stools. This is what we call it as tenesmus. So violent tenesmus, dysentery is what you need to remember. Dysentery alternating with rheumatism. I hope you understand the meaning of alternating. When there is dysentery, there will be no joint affections. When there is joint affection, there will be no dysentery. This is characteristic. Probably the last, and then we'll take a break. Now, this Can somebody quickly interpret what is it that I'm trying to tell? A second year student, a pathology student. Now, what is it that I'm trying to tell here? I have an image here. I have an image. Wild guess. What could this be? Very good. Somebody has got it absolutely right. Yes, beautiful. I'm happy. Yes, as a second year student, you are talking of concentrated urine. Beautiful. Bloody urine, inky urine. Yes, and it's a delight to teach students like you. Like, and I mean, yes, to the point. You did not tell urine. You told concentrated urine. You told bloody urine. You told inky urine. Beautiful. Keep it up. Okay. It shows a bright future for homeopathy. Youngsters are doing good. Now, we saw in the sphere of action, it's a remedy acting on kidneys. And I told acting on kidneys, it will cause nephritis. Okay. The result of nephritis, the result of inflammation in colchicum is reflected on the urine. Urine will be dark, urine will be scanty, urine will be in drops, and urine will be inky urine. Okay, I hope you are clear. The last characteristic symptom, we are talking about desires of colchicum. Now, once characteristic desire colchicum has desires mustard. Please remember this. What is it? Desires mustard. They also have desires for wine. They have desires for cold things, and they also have desires for coffee. So, four characteristic desires. And what stands out in colchicum is desires mustard, mustard, mustard. Very, very important. Okay. Now, this will be the mind I'll be taking up in the next class. Try to digest this. Don't nauseate, don't vomit. Try to digest the information given to you. A quick recap, we spoke of sphere of action, we spoke of pathogenesis, we spoke of ailments from, and the last component was characteristic symptoms of colchicum. Okay, so any quick questions? Because you have a class at 10 and you should not be late to your class. Any quick questions? Are you clear with colchicum? Okay. Next Friday, we'll talk of the mind and the particular symptoms of colchicum. Okay. Any questions? No questions. Good. Chalo, thank you for joining, and we'll meet next week. And I've already given you the topics that I'll be dealing, mind and particular symptoms. Kindly go through, preferably Kent's, and I want you to start your material career with good books. So preferably Kent's you can read, and a small book if you feel Kent is little heavy for you, you can read Alan Skinner. Okay. So thank you for joining, and good day.